Chest infections are very common in dementia units, especially amongst the elderly, but also amongst the young dementia residents that come into the unit. They're often so stressed with the confines, and if they're not taken out for walks and exercise by friends and family, the stress impacts on their autoimmune system and they can succumb to chest infections, sadly. So that's why it's so important for young, fit, strong dementia residents to get the fitness and the exercise to be able to reduce their stress enough that they don't succumb to such conditions as fatal chest infections. Now, say your mother's elderly, she's got a chest infection, how can you help? Bring in a box of tissues. They are not provided in dementia units, astoundingly, and they are totally and absolutely needed. Because if a dementia resident's nose is streaming, they're coughing, they've got no tissues, and they're in the lounge, they're ostracised by the other dementia residents who don't want to get the infection and can see the nose streaming and know that that's infected material. Sad. So bring in the box of tissues, 1 for the bedroom, 2 for the wardrobe for spares. Inform the carer that you want your mother to have access to these tissues. If your mother has a walker and a carrier bag attached to the walker, that's excellent for the box of trusty tissues to go in there. If your mother's an independent walker, walking, and she hasn't got access to a walking basket, then find a way that she can carry around the tissues with her. Maybe pack the tissues into her cardigan pockets, jacket pockets, so she has access. Otherwise, what happens all day in the winter, nurse, can I have a tissue? But there aren't tissues. You usually go to the kitchen to get a serviette. I mean, there might be tissues in this back staff area, but they're not readily available. So it's normally napkins from the dining table that the residents take for tissues, but they need ready access to tissues right there. Now, hankies, some manage initially, but on an ongoing basis, they get lost at the laundry. They're very small, they go missing, whereas really expendable tissues are much better where they can be thrown away. Now, in the bedroom, there is a waste paper basket in the bathroom, but if your parent is sitting in a chair in her bedroom, it might be a good idea to get a little waste paper basket beside her chair so she can put her spare, used tissues in that. Okay, box of tissues, very important. Now, if your mother is having sputum, rattly chest, and she's having difficulty coughing, encourage her to cough, encourage her to blow her nose, activate it, and come on, mum, you've got to take a few deep breaths, have a big cough out the sputum and give her a few tissues and then throw it into the bin. Now, if she's having difficulty coughing, I'm going to show you a physiotherapy technique now. I'm a physiotherapist, former physio for 40 years. A physiotherapy technique which you can use. Now, normally physiotherapists do this, but if you do this gently, and as I explain, it will be safe. It has to be gentle because with osteoporotic bones for elderly people, we always have to be careful. Okay, so if mum's, you can see she's trying to cough up the sputum, but she's having a hard time of it. There's 2 techniques. First technique is called cupping. So you cup the hand like so, you can see there. So there's air there, and then presume this is the back of my chest, okay. Your mother's chest here. A relaxed wrist like this, and you can hear the sound. So that's the percussion that's going right through the lungs and loosening up the sputum. So you just do this, the same technique, all across the back of your mother's back. She'll say if it's too hard and she doesn't like it. It's actually quite a relaxing technique because coughing is exhausting, especially when you're older. You haven't got the muscles that you had when you were younger for your, thorax, and they get weaker. And if you've got to cough all the time, well, the muscles get sore. So anyway, if you can help a bit with this cupping technique. Secondly, percussion. You put one hand on the front of the chest wall here, one hand on the back of the chest wall, and you say, okay, mum, breathe in and breathe out. 3 times, breathe in and breathe out. And you just do a firm and breathe in and breathe out. So you're just doing a mini little push as they breathe out. And the sputum will shake up, and you ask mum to give a cough as you're doing it for the 3rd time. Now these techniques will help her bring up the sputum and cough into the tissues and throw it away so they can breathe, breathe easily. And then of course the lovely deep breaths. And you might want to give a little bit of a neck massage because all the shoulder muscles get a bit sore, and any lemon honey drinks and vapor rubs and whatever other little things you do to help people with chest infections. And of course your support and company being there all the way through is very comforting. So I've written about these and more in the 2 books, The Resident's Voice, The Resident's Rise. Thank you for your viewing, looks. Please subscribe. Thank you.